Of Pharma Talk. Today I'm excited. We're going to be talking about AI. So we're going to be tagging on to a little bit of the main stage presentation that we had yesterday where we had 3 HealthMark customers talking about AI and what they're doing with that in their pharmacy practices. So first of all, who the heck is this guy here moderating? I'm Mark Crouch. I'm one of the HealthMart Vice Presidents of Pharmacy Retail Operations. And all that means is think of me as a business consultant for HealthMart for all of the resources and tools and solutions that HealthMart has to offer for our customers. So today, I'm joined by these 2 gentlemen. We've got Raj Chowdawa with RenewRx out of Texas. I've known Raj for going on 10 years, so always a pleasure presenting with him.
Thanks.
We've got Mark Ost from Pennsylvania, Eric's Prescription Shop. Mark spelled with a C. I'm Mark spelled with a C. That never happens, so take it all in, and hopefully we'll have some good synergies here. But as I mentioned, we're going to be talking about AI today. We've got about 15 minutes to ask some questions of these gentlemen, and they're going to give us some of their expertise. And then we'll have 5 minutes at the end for some question and answer period. And then I'm sure Raj and Mark would be willing to hang out at the end for a little bit to answer any other questions. Okay? Sound good?
Yep.
Sounds good.
Awesome. All right, Raj, we're going to start with you. So tell us a little bit about yourself, your pharmacy practice, your community, and the patients you serve.
So we have a few pharmacies in the Texas region that support, they're with provider practices, as well as we have a call center hub that supports the fertility clinics throughout the U.S. And so with us, one thing I'll say, for understanding technology, we get a lot of feedback here by learning from good partners. I've known Mark for a couple of years, and we kind of bounce things around. But the biggest thing that kind of prompted us to go in this direction is technician shortage. Just the labor, trying to figure out how to use our labor more efficiently, as well as finding ways to not only recruit, but effectively use our techs for the right things versus repetitive things. So.
Perfect. All right, first question for you, Raj.
Yeah.
Is what AI tools are you using, and really how have they impacted your pharmacy operations?
So we've been using some form of fashion of either automation or very basic aspects of AI for about 3 years. So in the fertility space, we have a hub, and that hub ingests prescriptions. Well, in general, we got about 1 million scripts that come through, but of that, you got 400,000 variances of the SIG, so the product and the SIG. So we're able to take that, clean it up, and then you utilize a bot to automate that entry and push that entry from submission into the system, clean it up with a standardized SIG code, and then move that on to verification. So that, initially when we were doing this, it was about 10 to 15% of our script volume. Now we're doing around 60% of our script volume is going through this clean path. So that was able to help us to take those technicians versus doing data entry, they could focus more on prior authorization. Recently, we've now looked at our IVR system and saying, how do I take my IVR system and really kind of put it on steroids? So it's not just a phone chain or a call chain, but how do we use AI or algorithmic data to show, okay, when an individual calls and they're engaging my IVR system, it gives the patient other options to be able to engage, either a chatbot or the IVR system is now intuitive and it can have a conversation with you. In the beginning, it's pretty rough because we're learning through this with this company as well. But as we've gone through this, the renditions are getting better and better. And so that IVR bot, we can call, it can say, hey, I'm picking up my lisinopril. It'll confirm the lisinopril refill and then say, well, your atorvastatin needs to be filled as well. So there's no engagement. We've seen about a 30 to 35% reduction in our phone volume because of that, and that's just starting.
Wow, okay, that's great. So how'd you choose those AI vendors that you're working with?
So we follow 3 very, very important things. AI is such a buzzword. One, it's to understand exactly what it means. A lot of vendors will utilize the word AI, and it's truly not AI. It's just conceptual automation, and it's not really true artificial intelligence or artificial general intelligence. So when we look at it, we look at 3 things. One, does that company have in-depth pharmacy knowledge? Like, do they understand pharmacy? Number 2, are they focused just in the pharmacy industry? Because if they're focused in the pharmacy industry, that means the data that they're going to pull in is going to be very unique to pharmacy, and then that data can then be structured to benefit us versus you're going to pull in clinic data that pull noise into the system. Then the third thing we look for is, will this system reduce at least 60 to 80% of the administrative work or the non-judgmental skill tasks that my staff has to do? Or will it assist in what we call that healthcare sludge aspect, that when you're billing a prescription to a PBM, there's all that prior auth stuff and that noise. Are they focusing and insisting on that? So if they can hit all three of those areas and it's fair and consistent on the pricing, we're ready to engage with them and go further down that route. So.
Okay, no, that's great. And I think the next question I was going to ask is, how do you evaluate the ROI? And I think you kind of answered that.
One thing.
Was there anything else?
Yeah, I mentioned on the ROI. Just be careful with the pricing. There's a lot of individuals that say AI out there, and they gouge you. They'll do double, for example, double the amount of the IVR system, which is not an appropriate way to move forward. As you notice, anyone that's around here that got a laptop the first time 20, 30 years ago, how expensive it was, and now what it is now, you're seeing AI drop significantly fast in pricing. So don't get locked in pricing, and then a year, 2 years later, you're noticing that the price reduction should be significant. So.
Well, that makes great sense. So lastly, Raj, $1 million question here. What advice would you give these folks out here just beginning to explore AI solutions?
Yeah, I was just dive in, start to kind of understand the terminology, understand. I'm no expert in this. I had to force myself to dive in. I've got a brother that I compete with. He's a technologist. He's a business owner, so I have to sometimes act like I'm also as smart as him. So I had to figure this stuff out. So there's a lot of YouTube videos. There's actually a pharmacy-centric AI program. You can Google it. That kind of starts you to say, okay, what are all the terms? What do they mean? So that's my first advice. Just dive in. Start looking at some videos and see what it is.
Awesome. Perfect. Okay, well, we got to give this guy here, Mark, a chance to talk. So, Mark, tell us a little bit about your pharmacy, yourself, your practice, community you serve.
Sure. So, first of all, my name is Mark Ost. I am co-owner of Eric's Rx Shop, a retail complement pharmacy outside the Philadelphia area, and also Community Pharmacy Services, which is a closed-door long-term care pharmacy in Ambler, Pennsylvania.
Awesome. All right, so tell us a little bit about how AI has transformed your workflow.
Sure. So specifically at Eric's, we're especially since the pandemic, we've been known for vaccines. We do a lot of vaccines. It's a lot of non-PBM revenue, and one of the things that we've always tried to do is how do we become more efficient? We know that we can give X amount of vaccines per hour. How can we increase that number? How can we also make sure that we're getting paid for the things that we're doing? One of our initiatives that we took upon this year was I think we do a pretty good job of medical billing and being able to bill insurers for not only the vaccine but the administration. And we partner with the company DocStation, and they have a lot of AI tools built in that as simple as you get a remittance and it explains that remittance code to you. A lot of times you see it and it doesn't make sense. This actually tells you what it means, but also how to fix it, of why that location code was wrong, or whatever it is. The other avenue that that they have built into is a way of knowing where that claim goes. So if anybody does vaccines, COVID, flu, and pneumonia, goes to Medicare Part B, except if the patient has an Advantage plan. Also, except if the patient has some other type of insurance. So they have AI tools built in that can help route that claim to the appropriate payer. And again, making sure that you're getting paid for the vaccines you're given and the work that you're doing.
Wow, no, that's outstanding. So this next question, kind of near and dear to my heart, but you've also mentioned to me that you use ChatGPT. Big fan, not of ChatGPT, but Microsoft Copilot that we're using with McKesson. I can tell you it's kind of transformed the way that I do my work, and I hear you're using it at your pharmacy. Tell us a little bit about how you've been able to utilize that.
Yeah, I mean, one of the things that we started with AI was just really starting very rudimentary. For vaccine clinics, we specifically tell ChatGPT, we want a flyer for a vaccine clinic with this information. Now, what we learned over time is that the more details that you can give the system, the better off it will be. If you just say create a flyer, it's going to use whatever it is. But if you can give it exactly specific details of, I want a 70-year-old lady with getting a vaccine and at this place and this time, it really can create a lot of useful stuff. And it saved a lot of our cost on design of just being able to use that software. we use it for information. We use it to check things. The one thing that I think is important to know about AI, it's not always correct.
Oh my gosh, I'm so glad you mentioned that. Yes.
We're estimated about 98%. So we don't use it for anything medical per se yet. I think that's some of the things that we're looking at is, how can we use it to help patients with medical advice and do a lot of those things. But, for a lot of our administrative tasks, it's been extremely useful.
No, that's fantastic. Yeah, those prompts telling it what to do are key. And you can make a heck of a funny meme too with it. So anyway, side topic. Right. All right, so with all of this AI, Mark, how do you strike the right balance between AI-driven efficiencies and still having that personal touch with our customers that independent pharmacists are known for?
Sure. So if anybody's ever met my business partner, Eric, sitting right there, he would probably still use the typewriter if it was up to him. And it's one of the things that kind of makes us work well is that we have the balance. I'm more technological driven, and he's more pen and paper. And I think that we're able to strike that balance. I mean, you talked about the IVR system. I looked at an IVR system where it has a full-length conversation for you. And I think it's really cool and really awesome. But one of the things we discussed is we have a lot of senior citizens, and what they call the store, and they want to talk to Eric. They want to talk to the techs, and they want to do that. So, and I think that's one of the things that sets us apart from a lot of the chains is we pick up the phone. And, something simple like that makes such a difference to those customers. So, efficiency, I think, is a really key part of AI. Kind of what Raj was talking about with data entry. We were done some beta testing with some of our software vendors to look at, not necessarily replacing a technician, but making it easier. And the other thing that's really important about AI is adaptive learning. So the more that you can teach it, the better it's going to be. The more that you can create that preference of what you want, how you want it, and how it's going to display that information, the better results you're going to get from it.
No, that's fantastic. I love the idea of freeing up time for the techs and the pharmacists to focus on other things.
Sure.
So, last question for you, Mark. So, pharmacy owners here, there are probably some of them are a little bit hesitant to get started. Any words of wisdom on how to get started?
Yeah, start small. My first recommendation is $20, $40 a month for a paid subscription to a ChatGPT or Microsoft Copilot. We use RingCentral, one of our pharmacy. It has an AI tool that takes notes from the conversation. And these little things that, is really, that doesn't cost that much additional, become huge down the road when we have to say, okay, well, what did this facility say, or what did this nurse say? And we can go back to those AI note takings, and it tells us specifically what it says. So start small, and just I think the thing I'll say is just be careful of, AI is learning. So what you tell it, it's going to learn. So we don't upload HIP information. We kind of keep it at a surface level right now, and are continuing to look to see how we can engage it and improve what we do.
Oh, that's outstanding. So probably a lot of questions out there. So we have time check about 5 minutes or 6 minutes or so for question and answers. So I think we've got a microphone runner out there if you're available. Any questions, raise your hand and we'll get a microphone over to you. They are all hesitant.
I'll add one thing that you're saying about ChatGPT. We're all pharmacists here, but we're all business owners as well. On that $10 subscription with ChatGPT, how many contracts do you have to review on a regular basis? It is really, just that $20 a month is worth it just to run a contract through there to see if that contract is based more pharmacy friendly versus the vendor friendly. That $20 alone right there, just on a right phrase to fix it, could save you hundreds of dollars. So.
Yeah, we use it before I send an email a lot of times. I'll upload it and say, how can I sound smarter? How can I sound dumber? How can I make this more patient-focused or something in that sense? And it does a pretty good job of that.
And on the IVR system, too, it gets smarter, too. So, like, that comment, we had that concern as well, that some of our patients don't want a voicemail. They don't want to use an IVR system. Well, once that patient's registered, the IVR learns, and when that patient calls, it'll reroute them. It won't even go through the IVR system. It'll go direct. So at least you kind of reduce who wants to use it and who doesn't want to use it. So.
There's so many functions. I'll give you a real-life example how I use it. So recently I'm going to be taking over territory that's in Iowa, and they recently passed some pretty good PBM reform bill. I had no clue about it because I wasn't tracking that state. So literally in seconds, I told Copilot, give me all of the details of the new legislation, 383, I think it is, in Iowa. And literally within 30 seconds, I'm reading through this. I knew what was up with that bill, which before I would have had that 60-page bill that I would have had to have gone through, probably would have called our public affairs folks to try to understand these things. And in seconds, it took probably 3 hours of my work. And I'm not an expert on it, but I sure know a heck of a lot more about it than I did the 30 seconds before I did that prompt.
There's tasks that take us hours to do. Like, I don't know, everyone in here, how many of you guys look at your GCR and your buying rates and then compare that against your reimbursement rates and you're trying to match up? Hey, does this make sense? Again, anything you put in ChatGPT, aware that it's now public data, right? So you don't want throwing that in there, but we're looking at now companies that say, okay, you have pharmacy data in a closed loop. How do you start looking at our buying, what our contracting is on this side, and then what our reimbursements are on this side, and match what's my delta here? How do I am a more sophisticated negotiator, and it does it in a few minutes.
Yeah, data analytics is, I think, probably the most useful part of AI.
Absolutely. Any questions? It's a shy group up here. I mean, we could probably banter about it all day, no doubt. But
And if we don't know the answer, we'll just ask AI.
AI, yeah. We'll Copilot.
Is this working? Oh, yeah. I was wondering if either of you guys see any opportunities to leverage AI for DSCSA data analytics.
So I will say on the DSCSA, and I can speak to it more on one specific, and this is in the fertility space. So in the fertility space, we have to track the branded meds, and so we have the ability to then kind of utilize AI to be a little bit forward-thinking and say where the gaps are. We're seeing things happen in that space to keep the pharmacy more compliant. Are all the records right? Can it go match up and make sure that it is tracked? Is there any recall? So we're looking at that. So that way you're not manually doing a lot of this stuff. It can be done just, hey, it popped up and stated that. So.
Yeah, similar to what he said. I mean, even the analytics part of it, making sure that your files are there, making sure that the invoice number matches up to the pedigree, which matches up to what's being scanned at the point of sale. And I think there's a lot of useful cases that it can be used for. And hopefully, I would say not just from our standpoint, but from McKesson, the manufacturers, the whole supply chain starts using it to make it ultimately easier for the end user, which is us and the patients.
I don't know if there's any 340B pharmacies here. If you're a covered pharmacy with a covered entity, the reporting to ESP is a nightmare. And we're now looking to see how do we utilize an AI algorithm to kind of reconcile this prior to submitting to ESP. Because once you mess it up in ESP and it goes up, you can lose that contract before. So we're looking at that as well. So not exactly DSCSA, but it's still inventory management. So.
Yeah, I really just think we've just tapped into the capabilities, and it's just it's going to grow and grow exponentially over the next few years. We're already seeing some very, very cool things happen, and heck, I use it in my personal life too, guys. Like I'm cooking a brisket on my Traeger. Give me a recipe, and how long do I cook it? And boom, in 30 seconds, it's there.
I'd say ask your kids. Like, my daughter is nuts on this thing. Like, we pay for the subscription, so she has it on her phone. Things she does, blow you away. Just see what. Be careful, because they're also doing their homework on it too. So I'm just
That is true.
Just one anecdote. We had a student. One of our pharmacy managers had a student that was looking up a question on ChatGPT, and it was completely wrong, and they were utilizing that. So that happens too.
Yeah, it does.
It does. You've got to trust and verify for sure. Any other questions? All right. Well, I think we'll wrap it up. It's time, so we will hang around here a little bit if anybody wants to chat afterwards. But Raj, Mark, thank you very much.
Thank you, Mark.
Appreciate you guys, and have a great rest of your show. Thank you.
Thank you.